Alright, so first I'm going to do a valgus stress test to see if there's an MCL strain. Basically what I'm looking for is laxity or pain compared to the other side. I'm going to test at 0 degrees and inflection. So first thing I'm going to do is unload the joint at 0 and then add a valgus force. Is there any pain with that?
No.
I'm looking for pain right along the meniscus here. So then I'm going to test again at 30 degrees. And first I'm going to unload the joint and then I'm going to load it again, adding a valgus force. Is there any pain with that?
No.
I don't feel any laxity. So I'm quickly going to test again on this side. So I'm going to unload and then add a valgus force. Any pain?
No.
Unload, add a valgus force. I don't feel any laxity. I'm going to test again at 30 degrees. Unload and test. Unload and test. Any pain with that?
No.
Okay. Next, I'm going to test a pivot shift, which is the test for ACL strain. And what I'm looking for is to see if the knee clunks out of place at 30 degrees flexion. So I'm going to start in full extension and add a valgus force, and I'm slowly going to put the knee into flexion. And if it clunks out at 30 degrees, it would be positive for an ACL tear. So do that. That's good. So that side is negative. And I'll test on the other side. So add the valgus force, start at 0 and go into flexion. And again, it doesn't pop out at 30 degrees. So that was the pivot shift. I'll get you to flip over on your stomach, and I'm going to do a Pheasant's test. Can you just slide to the middle of the bed? Okay. So for the Pheasant's test, I'm going to flex both knees with one hand while adding pressure to the lumbar spine with my other hand. So I'm going to flex the knees as far as they go and add the pressure to the lumbar spine. A positive for this test is if he feels pain within 30 seconds. So I'm going to hold for 30 seconds. 30 seconds is up and release. Did you feel any pain?
No.
Okay. And that test is testing for any lumbar pathologies that might be present, which was negative.